Today we will discuss about diet in spinal muscular atrophy, SMA. Spinal muscular atrophy is a disease, it's a genetic disease in which motor nerve that supply, that control the activity of muscles die. When the motor nerve in the spinal cord that control the activity of muscles die, as a result, muscles become weak. And in the patients of SMA, that's the reason. That's why in the patients of SMA, they feel difficulty in walking, they face difficulty while eating, and they also, in some cases, in some patients, patient also face difficulty in breathing. So it's a genetic disease and it occurs due to mutation in gene SMN1 gene, that is a survival motor neuron gene 1. The main challenging point in the SMA patients is to balance the nutrition requirements. It's very difficult to achieve balanced nutrition in these patients. The reason is due to muscle weakness, the patients feel difficulty in lifting foods to their mouths, and the patients also feel difficulty in chewing the foods. In swallowing difficulties, they also face swallowing difficulties, and according to research, 36% of the patients face swallowing difficulties. And due to these complications, due to these conditions, the patient with SMA are unable to achieve their balanced nutrition. So in this condition, we recommend soft solid foods to those patients. So patients who are facing chewing difficulty, who are facing swallowing difficulty. So in those conditions, we give soft solid food so the patients can easily chew the food, can easily swallow the food, and so that can easily fulfill their nutritional needs. So in the soft foods, we'll recommend soft fruits and vegetables like banana, peach, melon without seeds can be recommended. Tender meat that should be cut into small pieces, and that should be well moistened with extra gravy. And then if we are giving bread to those patients, then crust should be cut off so the patient can easily chew that soft bread. If the person is unable, if the person is not able to chew the soft foods, if the person is not able to eat the soft foods, then semi-solid foods can be recommended in those patients. And in semi-solid foods, we recommend mashed fruits and vegetables. So you can mash fruits and vegetables with fork, and meat can be recommended. Ground meat that should be cut into smaller pieces, and that should be given with extra gravy, and this type of meat can be recommended in these patients. And but if the patient is also not able to eat semi-solid food, then pureed food should be recommended. So the pureed food, in pureed food we actually give foods like potatoes. We add extra gravy in mashed potato, and then fruits and vegetables can be given, but pureed fruits and vegetables. Yogurt with no added fruits can be given. Soups and meat with extra gravy, and in this condition, nuts and seeds should not be added in these pureed foods because these are difficult to chew. So we should not add these types of foods. And then fried foods and hard-boiled eggs, these also should not be added in the diet of SMA patients. So these mechanical soft diets should be given to the patients to fulfill their nutritional needs. But if the patient of SMA is unable to fulfill their nutritional needs through the use of these mechanical soft diet, if the person is unable to fulfill their nutritional requirements, then we will give food through tube feeding. So the foods can be given, the food can be given through NG feeding, nasogastric tube feeding, or through PEG feeding. NG tube, actually it's a nasogastric tube, and in this in NG feeding, tube is inserted in through nose directly into the stomach, and food, blenderized food or formula feeding is passed, or nutrition is passed through this tube, and that is actually poured directly into the stomach. So these nasogastric tubes can be used to, if the patient is unable to fulfill the nutritional needs through oral diet, then tube feeding is another option to fulfill the nutritional needs and to provide nutrition to those patients. So NG feeding can be given. And other option is another, that is gastrotomy. We call it, that is a PEG feeding can also be given if we want to give patient nutrition through tube feeding for a long time. If the patient needs nutrition for a long time through tube feeding, or if the patient cannot fulfill their nutritional needs through orally for a long time, then we'll use PEG. That's a percutaneous endoscopy gastrotomy. In this condition, a tube is inserted directly into the stomach. In the NG feeding, we insert tube through nose into the stomach, but in this condition, from the skin, we insert tube directly into the stomach, and then through nutrition is inserted or directly into the stomach through this tube. So NG feeding or PEG can be given, can be through these tube feedings. Nutrition can be nutrition support can be given to these types of patients. So when a patient of SMA in the start to give before recommending the diet to those persons, we must calculate the nutritional needs of those patients. For example, we first initially will calculate their, we'll do the nutrition assessment through anthropometric measurements. We'll do the nutrition assessment, and if the person has SMA patients, they can't walk, so it will be difficult. They can't stand and they can't walk, and so it's difficult to take their height and weight. So indirect methods can be used to take height and weight, like to take height indirectly. Knee height can be taken, and demispan can be taken. Through demispan, height can be taken, and in the infants, recumbent length can be taken. So these are the indirect methods through which we can take the height of those patients. And if we want to take the weight, as person can't stand on the weighing scale. So if you want to take the check the weight of the patient, measure the weight, then a chair with the measuring with the weighing scale that can be used. There are chairs with the weighing scale, so those chairs can be used to check to determine the weight of the patient. So after the nutrition assessment, we'll calculate the energy. So a dietitian can calculate the energy according to the patient need, according to the patient weight and height, current body weight and height, patient and age and gender. The dietitian will calculate the energy. So after calculating the energy, AMDR calculation should be done. AMDR, actually, that's acceptable macronutrients distribution ranges. Will calculate the macronutrients requirement. So the macronutrients requirement actually vary from individual to individual. So macronutrients requirement as from age, from individual to individual, for each age group, macronutrients requirement is different. So these are the recommended macronutrients values. So these can be used from these values. We can calculate the macronutrients requirement. And once we calculated the macronutrients requirement, then we'll plan a diet for balanced diet. We'll only give balanced diet to these persons. So we'll plan a balanced diet for those SMA patients. And if we want to give, we have to give a mechanical soft diet. We'll plan a mechanical, we'll guide the patient that how they can give a mechanical soft diet to those patients. So we'll recommend only those choices, only that can be given in the specific condition. So we'll recommend patient-specific diet in these SMA patients. And another point, If we want, you want to give blend rice diet to those patients, if the patient is unable to fulfill the nutritional needs from mechanical soft diet, then blend rice diet can be given in this condition, and then through NG feeding or through PEG, nutrition needs can be fulfilled. Vitamin D requirement, as a few researches, according to a few researches, vitamin D intake is insufficient in 75% of individuals with SMA type 1. So, and according to another research, 36% of individuals has a low level of vitamin D in their blood. And the patients who are suffering with SMA type 2 and 3 has a low level of vitamin D in their blood. So vitamin D levels should be checked initially in the blood level of vitamin D should be checked in these patients. So if there is a deficiency, so supplements should be provided in this condition. So if the patient is on vegan diet, vegetarian, then vitamin B12 levels should also be checked in the blood. So if there is a deficiency of vitamin B12, then vitamin B12 supplements should also be taken. So, in short, if we summarize our discussion, that in SMA patient, we recommend balanced diet. So after nutrition assessment, after calculating their energy and nutritional needs, our dietitian will plan a diet. We'll plan a diet plan, complete diet plan, and we'll plan the way how the diet should be given to their patients. So if you want to gain the weight of the SMA patient, then initially give the requirement according to their current body needs, according to the current body weight and height and age. And then if you want to gain the weight, then add just 30 calories. Don't need to add more calories. If you add only 30 calories per day, that actually will gain the weight. So gradually add extra calories and start just give their energy needs, then give calories according to their needs, and then gradually increase their energy needs. So if you have any question, you can ask me in the comment section. Thanks for watching. See you in the next video.